Welcome back. We have Dr. John Hovannisian on today. Nice to see you.
Nice to see you too, Ken.
And we're going to get into talking about pool safety, so to speak, eye irritation in just a moment. But you wanted to talk about, there's always coming up over the years that you've been on, the advancement in technology for looking at things like glaucoma has really advanced. And it seems like there's been a kind of another step forward.
This is a wonderful place to live for people who have eye problems, because many people don't know that Orange County, California is the Silicon Valley of eye care.
Yeah.
There are more companies here and more development of research in eye care than any place else in the world. And we're very fortunate because we have access to many technologies locally here that no other doctors have in most places, because we work with these companies to help them to make products and surgical services that help patients. And glaucoma is a big, big area of focus. Right. It's worth mentioning that glaucoma is a disease where typically high pressure inside the eyeball has pressure within it. That fluid pressure is higher than normal, and that high pressure very slowly and painlessly over the course of someone's life causes damage to the optic nerve, which is that nerve that carries the vision signal to the brain. And it's irreversible damage, just like brain damage is very hard to reverse. And so our goal is to prevent it from happening, to detect it early and do things to lower the pressure, usually that's the approach, and prevent the damage from happening.
And we've talked about this before, the different ways that this is done. Obviously, the first step is a normal eye exam, and hopefully you can detect that early. Once you do, and tell me about the different stages you might see and what can be done. Let's just start as a low stage, a medium stage, and a high stage. And let's start with the low stage, if you can find it.
Well, that's a great way to think about it. With a good, careful eye exam, and this is why it's good to have a doctor who repeatedly sees you over time, who does a careful exam looking at the different parts of the eye. Because it's not just about the pressure measurement. If you have normal pressure, you can still have glaucoma, believe it or not. You need to look at the whole eye system, at the optic nerve. And a qualified doctor, whether it's optometrist or ophthalmologist, can do that. So early stage is usually manifested by either high pressure or by some abnormality in the optic nerve. When we catch it at an early stage, there's no effect on vision. In fact, even in middle stage glaucoma, it's not until very late stage glaucoma that our patients notice a change in their vision, which is good and bad, because if you think that because you see well you don't have a problem with glaucoma, you could be sadly mistaken, and you can lose so much optic nerve function before you even notice symptoms. So that's why you need the exam, to find it early. So detection is certainly the first step. Now, in the old days, to lower pressure, the only thing we really did effectively was use eye drops. And eye drops work. They lower pressure. But we've learned over time, and actually Europe is the place that's leading the way in this understanding, that eye drops have their own problems, and that over a course of a lifetime, eye drops cause damage to the eye. And in some older people with glaucoma, we see problems that are more severe, caused by the eye drops themselves than by the glaucoma probably ever would have been in those patients. And so we've learned from the Europeans, who are now doing surgery as the first step in treating glaucoma, not giving eye drops, that maybe not as the first step, but surgery deserves an earlier place in the treatment plan for people who are diagnosed with glaucoma. And we're often talking about simple laser surgery.
And does the laser surgery, obviously we hear about that when it comes to your eyesight, is it pinpointed back a little bit further in the eye to relieve the pressure? How does that work?
Well, it's a great question, and there's a lot of confusion that, when people hear laser, they think it must all be the same tool. Laser just means a certain type of highly focused, concentrated light. And there are many different kinds of lasers that we use in many different kinds of procedures on different parts of the eye, as you're suggesting. And treating glaucoma, it usually is the front of the eye, but it's not the same procedure as we do for correcting vision with, let's say, LASIK, which is for helping people get rid of their eyeglasses.
Well, I would think that using laser surgery, it's probably done very quickly and probably relatively painless, right?
That's right, and effective. When glaucoma is at a mild stage where there may be 1 or 2 drops, very often we recommend laser treatment to reduce the number of drops, maybe eliminate the drops. But anytime you can simplify someone's life and you can go from taking one medication to taking no medications, or go from 2 to 1, it's always better, because we're not dealing with the cost. We're not having to remember. We don't have the side effects. So many problems that medications cause that are in small incremental doses, we get the problems that we put up with them. But if we can get rid of those medications, boy, our lives are better.
Yeah, definitely. Well, let's move on to, it's summertime, and some more problems may come up with your eyes. There's, of course, people swim more frequently, so you have the chlorine factor.
You bet.
You have what is good to use, obviously, is sunscreen, unless it gets in your eyes just by wiping it.
Right.
And also, if you're going down to the beach, you have the irritations of both salt water, and you never know what else is in the beach water.
That's right.
So what are some of the things to do to prevent that? And if you do get some irritations, how do you combat that?
Those are great questions, and so protecting the eyes is essential. When we're outside, as we are a lot more at this time of year, you want to protect your eyes. And a hat with a brim when you're not in the water helps. Even when you are in the water, helps a great deal. A pair of sunglasses that fits closely to the face will provide good side protection and good front protection from UV light. When you're in the water, there's really no body of water I go into without wearing some kind of eye protection, whether it's the ocean or a pool. There's no pool I would swim in or let my kids swim in without a pair of goggles on. And my kids now know, it's taken me 12 years with my oldest to convince them that if you're not wearing goggles, you're not going in the pool. And you avoid a lot of problems.
That's a good point.
Surface damage to the eye is very common. The bacteria and viruses that are in pools you become exposed to. And chlorine does not kill all of the organisms that grow in pools and can cause serious damage to the eyes. When you get irritation from pool water, from prolonged exposure, usually the body will correct itself, but lubricant eye drops or artificial tears, they're sold at the pharmacy without a prescription. Those can provide a lot of relief, and in a short-term way can make the eyes more comfortable. If the problem persists more than a few hours, you really ought to see an urgent care or an ophthalmologist or an optometrist for an exam to make sure there's not something more going on. We have medications we can prescribe that are not available over the counter. Very often those will help to quiet things down.
That's good to know. With kids, I know with my daughter, trying to get her to take eye drops is just... It's like you want to put needles in her eye. I mean, it's that bad.
It's drama.
That's what happened the other day.
Big drama.
However, would it help that if you just got a cool bowl of water and she put her face in there and opened her eyes in the cool water? Would that flushing him out somehow or compress?
Flushing is good when you think there's a chemical injury. Usually, pool water is dilute enough that flushing is not necessary.
Okay.
But yes, you can. We don't love flushing with tap water because it's not sterile. And, what you use in the eye, eye wash that you can get at the pharmacy is a whole lot safer than tap water because it's a lot cleaner. Our water quality varies, right? Parts per million of bacteria and other organisms that are in there. The other thing is that when you're going to have an injury like that, this is a tip I use for putting eye drops in my kids, is distraction.
Yeah.
And so I explain to the child that the drop is not going to hurt, but it's cold. And the best thing they can do is, as soon as they feel the cold of the drop, to start blinking their eye as fast as they can. Now this sounds funny, but I'm telling you this works, Ken. Blink as fast as you can, and at the same time count from 1 to 20 as fast as you can.
Okay.
And so, you put the drop in the eye, and as soon as the child feels it, they start blinking and counting 1, 2, 3, 4, 5, 6. And by the time they get to 20, the stinging has stopped and they're over it.
Yeah.
And I'll tell you, the darn thing works. It's a great trick.
I'll have to give that a try.
Try it with your kids. For your viewers, try it with your grandkids.
And of course, you mentioned sunglasses and all. You have kids, they don't like to wear sunglasses. They're hard time to keep them on. So
it's tough.
We do our best with that. I wear all even in the water, I have sunglasses on.
I do the same.
I don't.
I do the same. When you have fair skin and you have fair colored eyes, like you and I do, your eyes tend to be more sensitive to everything. And so you want to wear those. It's for people who have darker colored eyes, it's interesting, they're less sensitive. My kids have, all of them have brown eyes because their mom's a beautiful brunette with brown eyes. You know, they can put ammonia in their eyes, it doesn't bother them.
Yeah.
But they still got to protect them. They still got to protect them when they're in the pool.
Sunscreen in the eyes.
Yeah. Oh, it's terribly irritating.
We want to wear sunscreen, obviously, and inevitably it can get in your eyes very easy. It could be residue on your hands.
Yeah.
Even some of the sweat-proof ones, let's face it, if
Yeah.
you jump in the water, it's now
Sure.
coming into your eyes.
Yeah.
Same kind of a thing, maybe
Yeah,
just kind of...
you can flush if you'd like to. You know,
Okay.
usually it's a small exposure, and so just the tearing that happens in the eye is enough to dilute it. But if you get a lot of sunscreen in your eye and it's stinging a lot, it's okay to flush with tap water. And I want to, although I've said earlier that, you know, tap water is not as sterile as eye wash, I want to make it clear that if you have a, you know, bleach injury or any kind of chemical that gets in the eye, tap water is okay. You want to immediately flush with water, with a lot of volume of water for
Okay.
a long time, you know, when you have a real chemical injury. A little irritation coming out of the pool is not a severe chemical injury like getting,
Right.
like concentrated bleach in your eye. For concentrated chemical injury, who cares what it is, flush that out as fast as you can, just to be clear about that.
All right, great tips. It's always good to see you.
Good seeing you too. Happy summer. Stay
Yeah,
safe out there.
I
Wear your
will.
sunscreen,
You
wear your
too.
hat.
You take care. And Dr. John Hovannisian, Harvard Eye Associates, and I think we're having someone come on tomorrow
Terrific.
from you folks, and always good to see all you doctors over there. You got a great group of people
Thank you.
over there. Definitely.
Thank you very much.
We'll be right back.